2016 is when I was first diagnosed with kidney cancer. I never expected that. They removed my kidney when they found it was fully engulfed. And when it came back, they found that it had spread to my left lung and had the left lung removed. The doctor did a scan of my brain, and that's when they found that it spread to my brain.
It's horrifying, honestly, because he'd already had his kidney removed and his lung removed, and we thought, how in the world? You can't remove a brain, what do you do next? When they said it was going to be radiation, that was okay, as long as there's a plan. That's been our thing all along. If there's a plan, we're going to go with it. Once they had done the first 3 tumors or whatever it was, he was doing much better. It started going backwards again, and went and got that checked out. And when we found out it was the same tumor growing again, that was very disconcerting.
Brian had gone to other centers and had been told that his tumor was not resectable, not treatable because of the high risk, because of the location where that tumor was. Because he had already had a radiation therapy, external beam radiation, he was not a candidate for further external beam or cyberknife radiation.
What struck me was somebody who had been diagnosed with multiple cancers and somebody who was still in very good spirits. And so we talked about the options, GammaTile versus some specialized external beam options. But looking at his case and our serious concerns around potential long-term toxicity for radionecrosis specifically,
we thought that he was the perfect candidate for placement of the GammaTile.
At this point, we were thinking there's not much to do. I mean, the fact that you had the GammaTile option gave us something to be hopeful about.
GammaTile is a collaboration between a surgeon and a radiation oncologist because these are tile, like we call it. They have small radiation beads inside of these collagen plates that after we have resected the tumor, we can place these collagen plates with the radiation beads inside to radiate the surrounding areas of the surgical cavity where we remove the tumor, because we know very well that the majority of a tumor recur in the surrounding areas. So this technology helps prevent the tumor surrounding the surgical cavity recurs. It's an advanced treatment that can help patients that have no other options.
I like the idea that it's in there and it's working constantly for the whole time. And it's from the inside, it's closer to where the tumor is, and that it's going to take care of it without external issues. He's had some necrosis from external beam because it kills good brain tissue. And so this is right there at the tumor, and there's less chance of that.
Well, the GammaTile has allowed me to live on, and the idea of the tile is a lasting effect. I like the sound of that compared to the external beam.
The aha moment for me was when I was following the patients that were being re-irradiated. And something that was consistently seen is the patients who had received GammaTile, we just did not have as many issues with radionecrosis. And that was huge.
We'll always challenge ourselves of bringing the patient the newest and the latest technology that will provide the patient with the best treatments and outcomes. I can say that I'm proud to be working here at Inova, where we put the patients first. With our team of radiation oncology and medical oncology, our program is very tight, and we really strive to provide the best for our patients.
I mean, cancer takes so much away from you. You can't let it take it all away from you. You got to keep fighting.